A study that could change treatment in head and neck cancer, led by Dana-Farber Brigham Cancer Center, was presented at the 2025 American Association for Cancer Research annual meeting.
And this is really the first study ever to show an improvement with immunotherapy in head and neck cancer in the curative setting.
Dr. Robert Haddad, chief of the Division of Head and Neck Oncology, served as the Dana-Farber principal investigator of the Phase 3 Keynote 689 study, which randomized more than 700 patients to either receive the immunotherapy drug pembrolizumab before and after surgery for their cancer versus current standard of care, which is surgery followed by radiation and/or chemotherapy.
And across all of these subgroups, the addition of pembrolizumab to the standard of care improved event-free survival.
While the study showed this improvement for patients, Dr. Haddad says there were also two important observations. One answered the question of whether the addition of immunotherapy for these patients might negatively impact surgery.
So this study essentially showed that it was safe to give neoadjuvant pembrolizumab before surgery, and this intervention did not impact the ability of the surgeon to do the surgery or increase the rate of postoperative complication.
The other important observation was that fewer patients in the pembrolizumab arm needed chemotherapy and radiation after surgery, a finding that needs further study but might mean less complicated surgeries for patients.
We have to remove a smaller tumor now. We have to remove less of the functioning tongue, and that potentially would allow the patient to have better speech, and that will have less impact on swallowing function.
This is the first study in more than 20 years to show improvement over standard of care for patients with newly diagnosed, locally advanced head and neck cancer, and stresses the importance of getting multidisciplinary care if you're diagnosed with this disease.
And thus, we consider the study to be practice-changing and will lead to better patient outcomes and hopefully down the road, better patient function.